Welcome to Impact by DIFFA Dallas, the official podcast of the Dallas chapter of the Design Industries Foundation Fighting AIDS. We'll share valuable info about the fight against HIV and AIDS, what our organization is doing to assist those in our community, and most importantly, how you can help us make a real impact.
Hi, welcome to this episode of Impact by DIFFA Dallas. My name is Tim Garippa. Today I'm happy to be joined by two members of our board, by Shane Allen. Shane, welcome.
Thank you. Good to be here.
Of course. And via Skype, Meagan Kant. Meagan, welcome.
Hi, Tim. Hi, Shane.
Hi, Meagan.
Today we're going to be talking about our AIDS service organizations. And we have a variety of AIDS service organizations that DIFFA provides grants to within the North Texas community that do a variety of things, from medical, psychological, housing, food, an array of services. And what I think is so important that the community knows is just what types of services are out there. One of the things that is so important is for people to understand the services that are available to them. But then also when they're supporting DIFFA, where does that money go? Because it goes right back into the community. So before we kind of break it into sharing a little bit about AIDS service organizations, Shane, anything you want to share about our ASOs?
Well, I just want to say, as I recently joined the board of DIFFA, and I was always aware of the AIDS service organizations that exist in North Texas, but I didn't know how many there were until I joined the board of DIFFA, and the really intense granting process that we go through in learning about all these AIDS service organizations. And you're going to hear us say ASO or AIDS service organizations. ASO is AIDS service organizations. We might fall back into that habit of letters. But yeah, I thought it would be a really good idea for us, not a comprehensive list. We're going to leave people out unintentionally, but just a good breakdown of what everyone does and what's out there.
Yeah. Meagan, any thoughts from you?
Well, yes, I just, starting today actually is year 4 for me on the DIFFA board. And so I've been gone through our grants distribution process 3 times. The scope of the sizes of these different organizations, and also just the niche groups that focus on one problem and solve one small piece of the wellness plan for one AIDS or HIV positive patient is incredible. And for that just to be captured in our region, we're really, really lucky to have services and have volunteers and executive directors and even just physical locations where people can be supported throughout their whole process, from diagnosis all the way through to long-term care.
Yeah, no doubt. We're going to be talking about, obviously, a lot of our ASOs. We're not going to be fully exhaustive of every single AIDS service organization across North Texas. And we want to share some of the services, but it's not going to be exhaustive of all of the services. So I think that's important to know as we kind of go through today and go through the discussion. The first couple that I think are important to highlight are those groups that are kind of general, both general and emergency. One of our largest ASOs is the Resource Center. And a lot of people have heard of the Resource Center. It is one of the largest, if not the largest, LGBT organization and AIDS service organization in North Texas. And they provide resources, not just health services, testing, prevention services, care, but they also provide a variety of programming, right? So a lot of people have heard of Gay Bingo. We actually had a podcast recently about Gay Bingo and some of the services that they offer, but they offer youth services and different groups available through the Resource Center. They are a fantastic go-to just for any general item, because if there's something that can't be addressed within the LGBTQ community, they're going to know and they're going to have the right partnerships in place to address that. So the Resource Center is a fantastic organization, one of the groups that we are really, really happy to partner with. And I think one of the other groups that's also really important is GDMAF. And GDMAF is a small organization, but they provide essential financial care that's the last resort for some people. And we've heard amazing stories around people that have exhausted all of their means through different AIDS service organizations, and they couldn't pay for a month of their housing, or they were going to get kicked out, or they couldn't pay their electricity bill, or they needed critical medication for a month and they couldn't find funding through another area. And GDMAF is the organization to go to as a last resort to provide some of those critical funds. and they facilitate their funding through ASOs. So they are a fantastic organization that really help keep the pulse of our community alive, which is awesome.
And what I think is great about GDMAF is that if they can't help you, or if they know that you maybe haven't reached out to someone that you could have, they'll point you in that right direction and say, okay, you need this, this, and this. Well, let's first try to go through this organization before we provide these emergency funds. So they're really helpful in those types of situations.
Yeah. Meagan, why don't you talk to us about some of the medical and case management organizations that we work with?
Sure. So you brought up Resource Center, and what essentially happens, they're one of the first ones I ever witnessed in person, their whole process. So essentially it starts with diagnosis. As soon as you receive your diagnosis that you're tested positive, you're placed into the system, their case management system, and it connects all the pieces of what you need to start treating yourself, to maintain your mental wellness. And you mentioned things like housing, financial security, ensuring you can pay for your prescriptions. So that case manager takes you on and gives you all of the pieces that you need. They track your doctor's appointments. They track, like I mentioned, your financial assistance, your prescriptions, small things like, do you have transportation? Do you have, are you connected? We have, lots of homeless HIV positive and AIDS patients throughout North Texas. And they stay in touch with them. They create pathways for people to stay on track with their medications, with their appointments, and not skip a day of taking care of themselves. So it's a very, very large part of your maintenance, your self-care as you go through as a client with them. Like I mentioned, Resource Center, Prism Health is another one. East Texas Cares out in Tyler also does full service case management. You mentioned financial assistance, food assistance with the SNAP program. So when we are working with these larger organizations that have that infrastructure, they are doing above and beyond work more than just the basic title of a case manager. I mean, they take on so much more for each client.
Absolutely. Yeah. In addition to kind of medical and case management, we also have a variety of ASOs that provide psychological support. So Shane, talk to us about them.
Yeah, so the one that immediately comes to mind for me is Legacy Counseling.
Yeah.
I mean, it's in their title, so it's always a go-to, but they really specialize in psychological services and counseling services for people who are HIV positive in North Texas. So a really good organization. And a lot of these larger organizations like Resource Center, which you're going to hear a million times, will connect you to counseling services or help you through counseling services as well. And then A Sister's Gift, which you don't hear a lot about. It's a smaller organization. They're one of the grant recipients of DIFFA yearly almost, I believe this season as well. And they really help to connect women who are living with HIV and AIDS to counseling services. Beyond direct counseling, just their community efforts, and they're bringing women together and talking about what's on their mind and what's going on. In fact, there's a really powerful video that we shot recently with Janice Washington, who is one of the clients of Sister's Gift. If you haven't seen it, it's on our Facebook page. We posted it last week. Take a look at that, and also on our YouTube page. Really, really powerful.
Awesome.
I'd love to chime in and bring up one more facet of this, which is the programs that we grant to that actually do more than just the single person interaction. Project FAN is another one, I believe, at UT Southwestern that actually works with women, pregnant women and children. And then over at Children's Medical Center, they also have a plan or a whole program that is dedicated to women and mothers and their children up through adolescence, who are either direct clients or are just in the immediate family of a direct client. So it's a really far-reaching resource to have these programs through some of the larger hospital networks that support more than just than an individual client.
Sure. Great call out. Thank you.
Yeah. I think two important services is housing and food, right? And a lot of people take that for granted, but they don't realize that so many members of the community, even especially our HIV positive community, lose access to housing, right? The access to nutrition is critical for staying healthy. And so there's several organizations that we support that really focus on housing. When we think about groups like Samaritan House and AIDS Services Dallas, when we think about groups like Sonia's House and Hope Charities, like they're all amazing organizations that are providing that essential need for housing for our community. And Hope Charities is really interesting because they're I think they're the only organization that provides transitional housing for youth. And it could be for a variety of reasons, but the research shows that homeless youth actually are greater at risk for a variety of things. And so that transitional housing helps lower the risk profile of our youth. Food is another an important factor. And we have several groups like Access and Information Network, commonly referred to as AIN, White Rock Friends, and Dallas Hope Charities also provides food. White Rock Friends is an amazing organization that I've visited several times, and it's run out of White Rock Church, Community Church, and they provide one of the only hot meal services on Saturday evening. Right now, they're doing drive-through service. I don't know how long that's going to last with what things are going on, but they run on probably the leanest budget I've ever seen. And it is a powerful group of volunteers that provide hot service or hot meals for people in the community. They even have stories of how people have come on buses for hours just to get a meal from the church. Oh, wow. And it's not just about the meal, but it's also about the fellowship. It's about the counseling you can have from the pastoral staff there. They also have a food pantry, kind of a little grocery store that people can come and get kind of the essentials. So it's pretty amazing the stuff that those organizations offer. AIN also offers some other critical services like linguistic services, right? If we have Spanish-speaking members of the community that need to go to a doctor's appointment or some other appointment and they need translation services, AIN does that. AIN does medical transport. So if you need transportation to an appointment, they can provide that. So some of the services that are offered just through those organizations really provide the access to health that you need. So let's talk about financial assistance. Meagan, are you going to cover a little bit around financial assistance for us?
Well, I wanted to talk about just sort of some of the different facets of financial assistance that people can get for. You mentioned GDMAF. I love to talk about East Texas Cares out in Tyler. One, because they go above and beyond to help with the wreath collection event, which I chaired for 2 years. So I got to know them immediately when I joined the board, and they delivered like 15 incredible handmade wreaths from volunteers and from clients. And I just love their commitment to just being out there. They're in such an interesting space where their services they provide pretty much service all of East Texas, but pretty much, I mean, you think Mesquite going east, and they can provide services. So they do things like they help you get on SNAP benefits if you're not registered. They can provide financial assistance for your prescriptions if you need it. And we mentioned the housing assistance program. They have a lot of resources if you are in that region without having to come to Dallas Fort Worth. They can put you in touch with lots of groups. And then also, I think a majority of the larger resource center, Prism Health, and the larger hospital networks also have assistance programs or have social workers that can connect you with prescription drug programs, things like that. I think the fundamental goal of pretty much every single group, I always think down to Sonia's House, who provide transitional housing and a 6-month reintroduction plan for women who are leaving the hospital and are homeless and do not have a strong support network to get them into their own housing. They're providing financial support on a really granular level in terms of getting food donations from a local supermarket or from a volunteer and putting food in front of them on a daily basis in a safe environment. So they can build up their savings to get a job, to get a home, and that is the end goal of Sonia's House. So it's such a big umbrella term, but it can be something as simple as someone getting a cell phone.
Yeah. Shane, talk a little bit about.
Well, and same thing with GDMAF, like we were talking about earlier. Yeah. They've done stuff as seemingly small as replacing someone's tires on their car so they can get to a job interview or get to their job. Because if you're one paycheck away from homelessness or something like that, then you've got to make decisions. And something that small, some sort of emergency help like that can go really far. And then Dallas Hope Charities also has a fund specifically for people who are living with HIV and AIDS that DIFFA helps support financially, that can help you out in those emergency situations as well.
Let's talk about children, right? Because we know, I mean, obviously HIV is non-discriminatory. We have children at risk. So talk to us about the organizations that are supporting children's programs.
So Brian's House comes to mind immediately. Brian's House actually started in the 1980s to help children living with HIV and AIDS. Thankfully, because science has gotten better, medicine has gotten better, there are fewer children living with HIV and AIDS. So they've actually, because of that, had to broaden their scope to assist children with a variety of life-altering medical conditions. So they have a lot of really, really great children's programs. And I was on the Young Professional Board last year of DIFFA, and we did a lot of work with Brian's House. There's pictures on the YP Facebook page of YP Young Professional members helping paint pumpkins for Halloween and things like that. So really
that was great.
Yeah, and we even had someone dress up as Santa, a YP member dress up as Santa for Christmas time.
That's
so
awesome.
Really, really strong connections with Brian's House Resource Center, and others also have programs for youth, young adults, teenagers, and children.
Yeah.
So it's also one of those broader umbrellas that a lot of people offer those services, but Brian's House really specializes with children.
Well, I think there's two also that come to my mind that I've visited is Cook Children's, right? They offer services. Children's Medical, so they have an AIDS arm clinic that we provide funds for. And there's actually a book that we've sponsored for children that are diagnosed with HIV that talk about what it means to be HIV positive as a kid. They also provide access to a children's camp so they can meet other people like them so they don't feel isolated, which I think is pretty amazing. And then there's the Genesis Clinic, and the Genesis Clinic is also part of Children's. And I know, Meagan, you also participate in these visits, so happy to have you add some color in too. The amazing thing about the Genesis Clinic is they are one of the only organizations or clinics for children that focuses on transgender health. And the interesting thing about transgender health, and we know this from some research, is the transgender community has a higher risk profile for contracting HIV. And so the great thing about the Genesis Clinic is they can actually start care early. They can start to talk about mental health. They can start to talk about hormone treatments. They can start to talk about all of those things early on. And as part of that, talk about prevention and talk about safe sex and talk about all of those things to lower risk profile, lower the chance of transmission in the future, which is a fantastic thing. I'm really, really happy that we have that in the Dallas community. Meagan, anything you want to share from your visits with Children's or Genesis?
Yeah, so what's so special about both of those clinics is that they're looking at the whole picture of someone's health. Yeah. It's not just targeted towards your diagnosis. It's about how is that diagnosis filter into the rest of your health profile. Especially with Genesis, the work that they've done over the past, few decades, just in its creation, just in the fact that it existed and it's sustainably existing. When we were speaking with the team there during this past grant season, it was about they're not serving Dallas children. They're serving people from Arkansas. They're serving people from Oklahoma, from Louisiana, from South Texas, from the Southwest. Yeah. Their work extends beyond just our area, and they are trying so hard to create as much interaction with a particular patient. We talked about this, their mental health services. We talked obviously just the basic medical services. They're trying to create social groups. One of the goals they told us was to hire more support staff to create virtual communities during quarantine, during everything we're going through, so those children do not lose the connection to the Genesis Clinic. Because once they do, it's very hard to get them back. There's so much more there going on, and their support is it's needed even more right now. Yeah. And that is targeted at children. It's targeted at the families. It's how do we how do we give them everything they need to grow up as whole human beings?
Yeah, I think that's amazing. Meagan, share with us a little bit about our ASOs that really focus on social programs.
Sure. So what community building within the DFW area has just changed so much. And I love hearing how groups and how clinics and our ASO network are keeping people connected. Resource Center, to go back to all the wonderful work that they do, has some sort of virtual meetup almost every single day. Dallas Hope Charities has partnered with Oaklawn United Methodist Church to provide another meal services program, and it's going to be every single day starting this month. You can drive up and get a takeaway meal, and participate in just getting out of the house or seeing people, or even socially distanced, but just to stay in the loop with these amazing programs. I had a couple others written down. Daily Zoom classes. Access Information Network, AIN, is doing a Bastille Day fundraiser to 20% of the sales of the ticket go to feed an AIN client for one day. And the DARE Center they have at AIN is a community space that is for people to come and spend their day. That's where the hot food service is done. They have movie nights. They have seating areas, comfortable seating areas. If someone needs to come and take a shower, that's at the DARE Center. If they need a quiet room to take a nap because they're homeless, that's at the DARE Center. So obviously social media is the best place to find out right now what all these various programs are doing, but they're active, they're not giving up, and they're more engaged, I would say, than ever, because the need is there.
Yeah. And I think a lot of people need to know that obviously if you need these services, you can reach out to the organizations, but they don't need help just from people that need support. They need our help as volunteers and as donors. And a lot of these organizations, especially those that are providing food and shelter, they need some of those core essentials. They need the paper products. They need the cleaning supplies. So if you're looking to help out, you can do things like donate products. You can reach out and donate money. We'll get back to a time where donating your own personal time will become more and more valuable. Obviously, it's a little bit harder right now, but these organizations need help, right? There's so many great things that they're doing for our community, and they rely on volunteers, they rely on donors to make sure they can provide these critical services.
Yeah, as I'm sitting here, I'm reminded again at how far our reach goes at DIFFA.
Yeah.
Almost every organization we talked about, if not all of them, DIFFA has supported in some way or another. Yeah. And it goes beyond Dallas. We're called DIFFA Dallas, but we should almost be called DIFFA North Texas, right? Because it goes to people in Fort Worth, it goes to people in East Texas. And so every time you donate at difffa.org or by texting DIFFA to 243-725 right now on your cell phone, your money goes to help all of these organizations. Yeah. And what better time to donate your money, even $10 or so, when you're not able to donate your time?
That's right. That's right. These organizations are doing critical things in our community, and by participating and supporting DIFFA, you are supporting the organizations, you're supporting their causes. I'm really, really happy of what we do at DIFFA in order to support the community, because in the end, we all want to see an elimination of HIV. We all want us to see it get to a point of zero. And these ASOs are helping us get there.
Exactly.
So I hope you all learned a little bit more around what we're doing at DIFFA and, of course, all the great work our ASOs are doing. You can find out more about our AIDS service organizations through our website at difffadallas.org. Thanks for tuning in, and we'll see you next time.